If you are satisfied, we move on.
Thank you. I think I have quite a number of questions.
Yes.
Maybe I continue. I'll note so that I can ask at the end of the third question. Thank you, Honorable Speaker. Could the Cabinet Secretary provide a report on the status of healthcare services in KIAMBU County, given the doctor strike which has continued for several months, with reports indicating the vulnerable patient, including newborns, have been the most affected? Outline the steps taken by the ministry in collaboration with the county government of KIAMBU, to resolve the ongoing strikes, which has resulted in a strain on Kenyatta National Hospital as it is handling more than twice its normal capacity. Provide statistical data on the number of maternal and newborn deaths recorded in hospitals within KIAMBU County, particularly between June and September 2025. Explain the reasons for the withdrawal and redeployment of medical interns who had been posted to various hospitals within KIAMBU County.
Minister.
Honorable Speaker and honorable members, the first question on the status of healthcare service in KIAMBU County. My answer is this: a joint inspection by the Ministry of Health, the Kenya Medical Practitioner and Dentist Council, and other regulatory bodies within our ministry has found out that the service workload, outpatient department visits at facilities like Thika Level 5, KIAMBU County Referral Hospital have significantly reduced compared to the same period in the previous year, indicating a strain of service. And I have shared a table comparing between 2024 and 2025 in terms of visits. And Honorable Speaker, if you allow me, in June of 2024, 26,010 have visited hospitals in KIAMBU County. Compared to the same period in 2025 during the strike in June, only 17,772 have visited, showing a drop of 31.7%. July of 2024, there were 27,000 who visited, but July of 2025 during the strike, there were only 18,477, another 33.1% drop. And then August was 26,000, August of 2024 was 26,819, and same time, August of 2025, it was 18,033, a drop of 32. In total of those 3 months, in 2024, 80,452 people visited KIAMBU Level 5 hospitals. But in 2025, that dropped to 54,000. So there were 26,000 citizens of KIAMBU County who never accessed health facility in KIAMBU County. Maybe they were going to the neighboring counties, Murang'a, Nairobi, Kenyatta Hospital, and I would say how that has affected our referral system. The second question was the steps we have taken. Honorable Speaker, and I have evidence to provide. The industrial action in KIAMBU arose from a labor dispute between the county government of KIAMBU, which was the employer, and its unionist employees under the Kenya Medical Practitioners and Dentist Council, which has strained again our referral hospital Kenyatta, as it was handling more than twice its normal capacity because of the strike. Honorable Speaker, our intervention as a ministry, I have formally engaged the governor of KIAMBU by phone, by text, and I have written letters which I have attached for the House to use for reference, urging for a prompt, good faith resolution in the public interest to avert further service disruption. Honorable Speaker, how far I can go is limited. I've been limited by the Constitution since provision of health service is devolved. But now I want to report that the National Return to Work Formula Framework has been signed between the union and the government, county government of KIAMBU, my advice is that they should borrow a leaf from what we do in other counties, Lamu, Kakamega, many other counties which had resolved their disputes. And even with the national government, Honorable Speaker, where the national government allocated 1.75 billion in the financial year 2025 through the House to clear the long outstanding medical arrears and reaffirm their commitment to implementing. But the industrial action in KIAMBU County has now been resolved. The third question was for me to provide statistic data on the number of maternal and newborn deaths recorded in hospitals within KIAMBU County, particularly between June and September when the strike was on. Honorable Speaker, first I want to convey the ministry's deepest regret and the country's deepest regret for the loss of life during the period in question. Any maternal or newborn death is one death too many. And I really want to ask the House that our maternal mortality and child mortality in our country is not good. We are having discussion with our county governments. We will bring a report to the Committee of the Health of this House. I think it's something that we must discuss, that no mother who is not a patient, who is walking to a health facility to give us a living, dies and the child dies. That I think is unacceptable. But coming back to KIAMBU County, maternal and newborn services are highly sensitive to disruption in service delivery. So when there's a strike of healthcare workers, the maternal and newborn services are highly affected more than the other sectors. So during the month of June and September, during the industrial action in KIAMBU County, significant service disruption routine was reported to us through the Kenya Health Information System. And some staff failed to submit reports altogether. Some staff of KIAMBU County. And the Speaker, this is a very serious offense. And going forward, we will ask digitally through our digital health agency and our digital system, every health facility in our country will report on a daily basis any maternal or child mortality that happens in that facility. But for KIAMBU, it is very, very sad, Mr. Speaker, when staff fail to submit reports altogether, resulting to gross underreporting. Some of them are not reporting the right data of both maternal and newborn deaths. Notwithstanding these gaps, the county government of KIAMBU itself have reported 164 newborn deaths over this period. It is very sad, it's unacceptable, it's immoral, it should not happen in any hospital, private, public, faith-based, it should not happen. So 164 newborns deaths were recorded during this period of the strike. Further, in the same period, 14 maternal deaths, 14 mothers died, were reported. And this House should know that because of the reporting disruption, these figures might be grossly understated the true burden. And I want to now read the law for which this House has passed, that failure to report health data or to misreport is an offense under Section 59 of the Digital Health Act of 2023, Honorable Speaker, that this House has passed. And this offense include relating to non-submission, falsification, or obstruction of a required health information. So I am sure colleagues, healthcare workers who get licensed through our ministry from KIAMBU County, I want them and the leadership, they must be cognizant of the Section 59 of the Digital Health Act of 2023. And the ministry therefore proposes and will support punitive measures against any officer found culpable for non-reporting or misreporting in accordance with the Act passed by Parliament and all other applicable public service regulations. The reasons why we withdrew and redeployed the medical officer interns who had been posted to various hospitals within KIAMBU County. Mr. Speaker and honorable members, I want to report KIAMBU County received, because of the number of level 5s and the health facilities and the population, received the highest number of interns. The withdrawal and the deployment of medical officer interns, amongst other healthcare interns, was necessary due to the industrial action in KIAMBU County. These interns, by law, must obtain interim practice license that is strictly conditional, and the condition is they must be supervised by qualified and licensed medical consultants. And this industrial action resulted in the absence of crucial supervisory support, meaning that the internship training standards could not be met by these interns. They could not receive it in KIAMBU County. And to avoid further delay in the commencement of the internship program, the ministry, under my signature, wrote a letter to the governor of KIAMBU, urging the governor to resolve the industrial action by the 15th of September to allow the internship and the interns to proceed. When the industrial action persisted past the deadline, the ministry had no option. We had to withdraw the interns with the effect from September 29 for redistribution to other counties where internship programs was going on smoothly and in accordance with the law. So as much as we wrote to the governor and he did not end the industrial action, we are the ones who pay interns. We, the ministry, are the ones who supervise, and we pay them through money allocated by this house. And they are Kenyans, and they have a stipulated time frame of 1 year. So, Honorable Speaker, we had no choice but to withdraw so that our interns can continue with the internship program in the other counties where internship program was proceeding smoothly. Thank you, Mr. Speaker.
Thank you, Honorable Speaker. I think I have two questions on top of what the CS has asked. And my first was on my first question, whereby, Honorable CS, you say that we have corrected 80.3 billion shillings as far as SHA is concerned. My question is, out of 81.3 billion shillings, how many have been claimed by the health facilities so far? And can you be able to substantiate, to differentiate between how much go to the public hospitals and how much has gone to the private hospitals? Because, Mr. Speaker, we run a risk of making sure that we correct this money from the public, but at the end of the day, because of the log, and because health is devolved, and because of the log governors who are not able to facilitate, or who are not able to fund, who are not able to make sure that the health facility are in good conditions, many people are going to private hospitals. And therefore, this money may tend to benefit more the private hospitals more than the public hospitals. And the decision that we made as far as the SHA was concerned is to make sure that we improve our public hospitals as far as that's concerned. Mr. Speaker, I also want to ask the CS DUALE, you know, the health is devolved, and we want to agree with him, but where can the minister get a grip? Because at the end of the day, when there is that discrepancy, when there is that problem between the county government and probably the health practitioners, the ministry cannot just sit down and watch people dying. The ministry cannot just sit down and watch health facilities get dilapidated. There must be something that the minister is able to do to call either the governor to order and to make sure that the health services are directed or they are given to the public. Because at the end of the day, even if health is devolved, the ministry has a responsibility to make sure that they provide health to the people of this country, Mr. Speaker. So therefore, can we also plead with the CS, because now the majority of the interns, the interns were taken away from the KIAMBU County, and not because now the doctors are back to work. Is it possible Bwana CS, because if you don't bring these interns to our hospitals, many of our people are now not going to be benefiting actually from the services rendered probably by these interns, Bwana Speaker.
Waziri.
Honorable Speaker, let me start with the second question on what the minister can do. I think all that I can do is administrative, which I have done. Health is devolved. The legislature has the powers of oversight. I have contacted the Health Committee of the Senate, the Health Committee of this House are aware, and it is the decision of the Kenyan people who have devolved. If today healthcare workers go on industrial action in our referral hospitals, which are under me, then I will. But all that I can do is to do administrative, write letters, consult with the Council of Governors, which I did, talk to the governor, and I think that I have done. On the matter of withdrawal of the interns, interns is a very important component on the training of our medical and healthcare workers in all cadre, whether they are doctors, medical officers, whether they are dentists, pharmacists, clinicians, nurses, and they have a period to do internship. We have already disrupted them when there was an industrial action in KIAMBU. I think it would be morally wrong for me to provide and tell them again, go back to KIAMBU. That's another disruption. So the next time I'm going to post, particularly medical interns, pharmacists, dentists, clinicians, and many of them, in my opinion, will be next year when I'll do the next cohort. In terms of how much we have paid, but before even I come to how much we have paid, I think under the Social Health Authority Act, there's no discrimination. Kenyans can access, if they are members, Social Health Insurance Fund. They have all the rights to access it, either faith-based, private, or public. And that was the whole essence of UHC, for health services to be accessible, affordable, and equitable. And that's why we are saying that if a Kenyan walks, even for primary health care, which is free, if he walks to the nearest facility, be it private or faith-based, he should get exactly the same treatment as that he could have got it. 2, how much we have paid in terms of the 3 different levels. For the county governments, we have paid about 23.2% of the total 64 point underchief. We've paid 64 billion. So 23.2% went to county government or public facilities run by our counties. Faith-based facilities receive about 16.87%, and the referrals receive about referrals that are Kenyatta National Hospital, Moi Teaching, Madare Teaching and Referral Hospital, Jaramogi, and Mwai Kibaki, Odaya. They have received about 10% of that share. And the private had the largest with 49.07%. This payout is driven by a number of factors, Honorable Speaker and members. One is the service utilization. How many services are available in all those 4 categories? 2, the type of procedures offered by those facilities. Inpatient, maternity, surgery, oncology, dialysis. the more a facility has those different types, the more they get more paid. And then Kenyans have a choice on the type of facility to access. So if they're in Nyeri County, for example, they have a choice to access either to Mutumu, which is a faith-based, or to access Consolata, which is a faith-based, or to access the Nyeri County Referral Hospital Level 5. Claim processing capacity and claims desk available are in all these facilities, whether it's private and whether it is in public or faith-based. When I come to now the primary health care payout, which is free, and this is now where, Mheshimiwa, I think your question fits well, where Kenyans walk in and walk out as outpatients. They are treated, they see a medic, they get drugs, they get lab tests, they can get the basics, but it's an outpatient. And all that they need to do is to register as SHA members, not chief, as SHA members. In the PHC, which I gave the figure of the 9.8 billion has been disbursed, county governments have received 56% of that 9.6 billion. The faith-based facilities in the public health facility, which is free, which is paid by the exchequer, have received 7% of the 9.8 billion. And the private facilities across our country have received 36% of this 9.8 billion that was paid out to all facilities that offered service under the PHC.
Thank you, Minister. Member for Nyandarua.